Hi, everyone. Welcome to our special program today, our webinar on speech language pathology, function, and the treatment of Parkinson's disease with Patrina Fischetti from Northwell. I do want to make a couple announcements. I'm Gloria LeBeau. I'm the Director of Social Services at the JCC, and I'm delighted to be able to bring you all sorts of programming for Parkinson's, from fitness classes to webinars to information. And we're always interested in your feedback and what you're interested in. So if you have any special interests and you haven't seen a presentation that has covered your interests, please get in touch with me. I put my name and my phone number and my email in the chat, as well as a link to the social services webpage at the JCC, because on that webpage we have recordings of most of the webinars that we have presented already, so that if you've missed any one of them, and there are so many and they're all really, really informative, so you can get on that page and you can really, listen to the recording and get some more information. But certainly take my name and number. If for whatever reason you're not getting emails from me, please let me know and I will certainly start sending out emails to you. Just want to tell you about some upcoming programs that I think are of interest. Northwell will also be providing a program on physical therapy on November 19th, physical therapy in Parkinson's disease. It's Thursday, the 19th at 11, and then on occupational therapy on December 17th, also at 11 o'clock. We are very excited to be collaborating with the Rebecca Center, a music therapy center over at Malloy College. They will be providing music therapy for Parkinson's with a focus on improving posture, breathing, and articulation. You'll be doing music making, singing, song discussion. I think it's going to be really fun, but it's also going to have that added benefit of helping you with breathing and with speaking. So I think it's a great class. It's free. It's open to the community, but I do need you to register. It starts on Wednesday, October 28th at 10:30, and it will be 10 sessions. So it's pretty exciting. So if you're interested, get in touch with me or go on our website and register for the class. My next support group that we've been running every month is November 12th. We have a bunch of more webinars that are coming up in December, so be on the lookout. We will be sending lots and lots and lots of emails out there. We also, for those of you who know people that are dealing with some kind of cognitive dysfunction due to either dementia or due to Parkinson's, tomorrow, Friday, we are having a dementia webinar called Dementia 101 at 2 o'clock in the afternoon. Dr. Joseph Gutman from NYU Langone is going to be presenting, called Dementia 101. So we just have lots and lots of stuff. If you're interested in that, get in touch with me and we will send out the Zoom instructions. All right, without further ado, I want to introduce Trina Fischetti, who is a speech language pathologist and has been since 2006 working in acute care rehab. She specializes in speech, language, voice, cognition, and swallowing disorders in the adult neurologic population. Trina has been trained in Parkinson Foundation's Allied Team Training for Parkinson's disease and neuromuscular electrical stimulation for swallow, which is called Vital Stim, and myofascial release for swallowing, and something called Speak Out, which is a voice amplification program developed by the Parkinson's Voice Project. She received her master's degree from CUNY Queens College in 2006 and has been a graduate student clinical instructor since 2011. And with those amazing credentials and knowledge, I want to introduce Trina Fischetti.
Thank you so much, Gloria, and thank you everyone for having me. It's a pleasure to be here, and hopefully I can give you some information to help kind of plot your course and to make sure that you get the most out of all of your therapies. I'll go over quick what we're going to be talking about. So the agenda for today is neurology and anatomy of Parkinson's. Very briefly, just to give you a little bit of background and what the cause of Parkinson's is. Then we're going to discuss swallowing difficulties, which is called dysphagia. speech and voice challenges, which are dysarthria and dysphonia, language and cognitive deficits that can occur. And then I'm going to just share some case studies of some patients that I have here, that I've had go through our program here. So the cardinal features of Parkinson's were first addressed by James Parkinson in 1817. Those main features are the tremors, rigidity, reduced or slowed movement, and postural instability. But we all know that there's a lot more symptoms that occur. Some are very easily apparent, and some are not so easily seen, but can also cause a lot of difficulty for us. Those can be speech, swallowing, bradiphrenia, which is slowed thought. So processing becomes a little bit slower. It takes a little bit longer to think things through. Apathy can really impact every part of life, where it's just difficult to get yourself going. Depression, anxiety, sleep disturbances, constipation, urinary problems, orthostatic hypotension, hypomimia, which is a lack of facial expressions, and can even go towards psychosis and hallucinations. So these are all things that people with Parkinson's have to deal with on a daily basis. Parkinson's is caused by a reducibility of the neurons in your brain to produce dopamine. And dopamine is responsible for controlling all of your automatic muscle movements. So walking, talking, swallowing, all affected. So Parkinson's is in essence a movement and sensory disorder. So it's characterized by reduced amplitude. So all of the movements are smaller, but it's also sensory, where it's also your perception of the movements, especially when it comes to your voice. The perception isn't really there. So because the movements all have become smaller, the muscles start to weaken. It's not the Parkinson's itself that causes the weaker muscles. It's the fact that they're not being used to their full capacity. And we all know if you don't use it, you lose it. So really all of your therapies, whether it's speech therapy, physical therapy, occupational therapy, are really based on targeting big muscle movements and utilizing all of your muscles to their full capacity. So speech therapists and specifically work with swallowing, speech, voice, language, and cognition. So those are the things I'm going to discuss with you. I'm going to talk about some swallowing difficulties that can occur. It is probably one of the main things that happens. It affects 95% of people with Parkinson's at some point in the disease process. And it can start very early on. It can progress as time goes on. And what we want to try and avoid is aspiration pneumonia. The aspiration pneumonia is caused by foreign materials entering the lungs. So whether it's liquid, solids, they can go into the lungs and over time will cause, well, a short amount of time, can cause aspiration and choking, obviously. Aspiration pneumonia continues to be the leading cause of death. And I feel like, unfortunately, what can happen sometimes is by the time people aren't really referred for speech until they've gotten an aspiration pneumonia. And now that they realize that there is a problem. What we are hoping to do is educate people to make it a part of their program so they can maintain their function before something goes wrong. Okay, so Parkinson's can adversely affect all three phases of the swallowing. So there's the oral part where you're putting the food in the mouth, able to close the lips, chewing, moving the food back, clearing the oral cavity. If anything is still stuck in the mouth after, and you don't realize it's there, that can move back and can cause us to choke. So that needs to function well. And the oral part is definitely affected by medication. That's the one part of the swallow that's really affected by your medication. So if you're having an off period, certainly chewing will be much more difficult. The oral part will really be affected significantly. So sometimes even managing your meal time and medication time for when it's optimal, it can be very important. The pharyngeal phase of the swallow is once it enters into the throat area. You have two tubes, one that you breathe through and the esophagus where the food goes through. If the airway doesn't close off fast enough, See, the food goes into the kind of little pockets on either side of the airway. And then those come together, close off the airway, and direct the food into the esophagus. If it doesn't close off fast enough, things will go down into the lungs. That's aspiration. Or if it gets caught in the vocal cords, you can choke. If there's food left over after you swallow, if the swallow isn't strong enough and not everything is passing through, now the food is sitting in your throat and you'll have that sensation of something being stuck there. And those are all the pharyngeal muscles that are involved in that. And then there's the esophageal phase of the swallow, which is once the food enters the esophagus. So essentially the swallow is done at that point, but the esophageal difficulties can also affect your eating because the movement of the food can be slow to go through. So you'll feel full quickly, and it can really reduce the amount of intake. So people will eat less because they feel full very quickly. Okay, the common complaints that people will report is difficulty with pills. That's usually one of the earliest where people will start to feel like they have difficulty getting those pills down. They report coughing and choking when eating or drinking. Excessive saliva and drooling, that's a common complaint as well. Food sticking in the throat, as I was mentioning before. Longer meal times, it takes a while to get the food down. Therefore, people start to avoid certain foods, creating unintentional weight loss. Recurrent pneumonias can happen, recurrent pulmonary infections because of that aspiration. So these are all of the difficulties that can occur. But luckily, there are things that we can do to make it better if it's already happened, or keep from happening if we have a good program of exercises. So some of the therapies that we use are oral, motor, and swallowing exercises. So for the mouth itself, if there's smaller movements, weakness of the lips, the tongue, there's exercises that we do. So smiling, holding it like this, then puckering. We can do lingual exercises. You hold the tongue side to side, click the tongue against the roof of the mouth. There's pharyngeal exercises. Even an effortful swallow, we call it. So if you gather your saliva and swallow hard, that engages all of those muscles a little bit more. There's another exercise that really is good for all of the pharyngeal muscles. It's called the Masako maneuver, in which you gather your saliva. Try it with me. It's not so easy to do. You gather your saliva, stick the tongue out like this, hold the tongue there, and swallow. You can feel how hard everything is moving. It may not be so easy to do at first, but it's a good one to practice. And there's another one, the acronym is CTAR, it's chin tuck against resistance. I have here something that I stole from occupational therapy, but you can use a ball, you can use anything that fits under here, and you press down and open. So you're engaging all of the submental, the muscles down here. And you hold it for 10 seconds like that, then 10 seconds off. And we usually do these exercises 10 times each. These are just some examples. There's others as well. And really, your speech pathologist would put together a program for you based on where you're at and what you're able to do. There is neuromuscular electrical stimulation, frequently called vital stim. They were the first to develop it. And it's we put electrodes on either muscles here or the face to increase the sensory information and the motor information. So it sends more signals to the brain, and that stays on while you're doing the exercises. There's myofascial release. We all know things can get very tight sometimes. So this is actual manual massage of the muscles to improve the tension. There's expiratory muscle strength training. We use here the EMST 150, which is the picture that you see here. This is the actual breather itself without the mouthpiece on it. It comes with this mouthpiece. So you put this here, and this you turn to give resistance. So you would start with your speech pathologist. They would figure out the proper setting for you. And what this says, you blow through this as hard as you can. And you do 5 sets of 5 with 10 seconds in between. And what this is designed to do is help your muscles of exhalation, of breathing out. If material enters the airway, our body's protective mechanism is our cough. And the cough is what's going to get that material out. So you need a good, strong cough. Over time, because of the muscles, the smaller movements causes the weakness, the cough can get weak, and that impacts the swallow significantly, because now things are going in and ending up in the lungs when they're not coughed out. So there's a lot of studies that are being done with EMST, with the expiratory muscle training in general, not only this device, but that really have wonderful results. Voice amplification programs. So the 2 major ones, the LSVT Loud and Speak Out, although they really are targeting your voice and your speech, also affect the swallowing. You know, it's all the same muscles that we're using. So when people go through those programs, they often report that their swallow gets better as well. And then there's techniques and diet modifications. So sometimes if you're having trouble with liquids, what might work for you is putting the chin down before you swallow, because it gives the liquid a little more time to go back. Thin liquids can become difficult over time because they're a bit more difficult to control. So there's different techniques that you can try, different movements ahead to the side. Those are things that your speech pathologist would figure out with you. And then there's diet modification. So sometimes people need thickened liquids. If the thin liquids are just too much to handle, there's thickeners that we use, and there's different thicknesses. There, you can cut up food really small, add extra sauces and gravies to things, maybe even puree things if the oral part is really difficult for you. And really, the speech pathologist would assess where you are now and what the least restrictive diet is. We're always aiming for the least restrictive diet. We want you to be able to have as much as you want and to enjoy your food. So although these have mostly been used in the past for people that have been presenting with dysphagia already, I make it a part of the program here to make this a part of your exercise program. You know, we all know that 3 times a week, at least 30 minutes really prolongs function and maintains function physically. The truth, it's the same thing with the swallow. If you make this a part of your routine and you do these exercises, the muscles stay stronger and you maintain your function longer. Okay, so I'm going to switch over to talking about some speech and voice challenges, which are dysarthria, which is the speech when speech is distorted, and dysphonia is voice difficulties. This is another major challenge for people with Parkinson's. Low vocal volume can be one of the first symptoms that we notice. The voice starts to get a little bit lower, and it affects approximately 75% of the Parkinson's population. That's pretty significant. The cause is poor perception of vocal effort and volume. So although people may tell you all the time, I can't really hear you, please can you repeat yourself? Your feedback is distorted. You're not getting the feedback. You feel like you're speaking at a normal volume. So for you to speak at a normal volume, you feel like you're yelling. That's what I'm frequently told. I feel like I'm screaming at people and I don't want to be rude. So therapy really aims at changing that perception and focusing a lot on feeling the effort that it feels for you to be at conversational volume level. So the symptoms that people talk about are reduced volume, slurred speech, harsh, breathy, or hoarse vocal quality. People will often say that I start to sound a little hoarse. That can really be affected. You can have voice tremors, difficulty initiating speech, or freezing of speech, which can happen also the same as your gait, and rate and pitch difficulties. So sometimes speech will come out very, very fast and it's hard to slow it down, or sometimes it's really, really slow. So all of these programs are aimed at kind of regulating and bringing everything back to the middle. The two major therapies are Speak Out and LSVT Loud. I hear for myself, I'm trained in Speak Out. It was, as Gloria said earlier, it was created by the Parkinson's Voice Project. And it really is a very straightforward, simple program. You do vocal exercises. So you get a book. I can actually show you one moment. When you start therapy, with your speech pathologist, you contact them, they send you this book, and every day has a lesson. And it's a 12-week program. So you start the lesson every day with the vocal exercise. I'll demonstrate one of them. Well, I can demonstrate all of them. So the warm-up exercises are taking a nice deep breath and saying, may, me, my, mo, moo, at a pretty loud level. I hope you can tell how loud that was. The second is doing an ah, nice and loud. And then there's glides. Ah, ah. So those are exercises you do every day. There's a counting exercise, and then there's a reading exercise. And every day the reading exercise gets a little bit more complex and longer. And it also has cognitive exercises, because as you know, the exercises are very specific of what you're doing. You can really concentrate on how the sound is coming out. When you have to formulate what you want to say and concentrate on how you're saying it, it gets more difficult. So every day you go through those steps to make it become more natural for you. And the premise of Speak Out is really using intent, doing everything with intent, thinking about how you're speaking, thinking about how your mouth is moving, and thinking about the loudness of your volume and how much effort it needs. So I think it's an absolutely wonderful program, and you really do see changes pretty quickly. I mean, within a session, I can see a difference in someone. And I think just the awareness that you're able to do it. I think people frequently feel like, I'm not going to be able to do it. It's going to be too difficult. It's a very easy program to follow. And I've had great success with it. Okay, on to the language and cognitive deficits that can occur. Excuse me. So although you hear and read more about Parkinson's dementia, the deficits can really run the gamut. Mild cognitive deficits can be present in the early stages. They can progress with time, but not all cognitive deficits will progress to dementia. And language deficits also. Though people will start to report word finding difficulties. People may have more difficulty with comprehension, really understanding when there's too much length and too much abstraction. When the language becomes abstract, it's too long, it can become more difficult to hold on to and to comprehend. And pretty frequently we'll see, even from the beginning, it can start off very gradual, and it can progress to be more difficult. The executive function deficits really are what people will complain about, or we notice that they're having difficulty with. So memory, more so like working memory, holding on to a couple pieces of information while you're trying to manipulate them, trying to figure out prices of things. If you're food shopping and you're thinking, okay, I want to add these 3 things, holding on to those 3 numbers as you're trying to add them can be difficult. Short-term memory can be affected. Attention is certainly something that people will complain about. And I often hear people say, well, I used to love to read, or I used to love to knit, play chess, whatever it may be, something, and they've stopped doing it because, I don't know, I just can't do it anymore. I lose focus. And that's really the main thing, that attention and it can be really difficult to make yourself focus. Organization can be difficult, whether it's your physical environment, organizing medications, finances, things like that. And even organizing your own thoughts can become a little difficult. And discrimination. really filtering out the stuff that we don't want to hear, that isn't relevant to what we're doing. So you're listening to this right now, but if the TV's on or someone's talking in another room, we typically can easily ignore that. But as if we have some difficulties, it can be hard to focus on one thing here when there's noises elsewhere. So it can be in any incoming stimuli, whether it's sound. Sometimes when things are too bright, that can be difficult for us, which also brings me into some visual spatial difficulties, that can also be affected. So depth perception can be affected, where things are, how far away. And all of this stuff can really, even at the beginning, can affect a person's ability to like handle higher level things. Like people may need some assistance with medication management. They may need some assistance with finances, filling out paperwork, things like that, to make sure everything is really organized well. And some of the therapies that we do is stimulation therapy. And this is not anything that even needs to be so structured with a speech pathologist. And honestly, we should all be doing it anyway. Anything that stimulates different ways of thinking, whether it's word searches, playing games on the iPad, playing card games, playing chess, like I said earlier, checkers, anything that stimulates the brain and that makes you think, makes you plan, makes you figure things out, uses memory. It's all very important. Metacognitive training, which is just having the awareness, discussing it, knowing, putting a name to it, say, okay, I know I'm having trouble with attention. I know I'm having trouble with memory. So just being able to discuss that and know and make a plan, which brings me to compensatory strategies. So if you know that you're having some trouble with memory, utilizing some strategies for yourself, whether it's setting an alarm on the phone, keeping a calendar, writing things down, using a pill box to organize your medication to make it easier so you don't have to remember so much throughout the day. Those are all things that can really help us out. You know, the main things that we really want to focus on is really your quality of life, right? Not being able to communicate effectively, not being able to sit with your family and eat a meal because you're concerned about choking, or you don't like to be around people because of your speech and people can't hear me. These are all things that really take away from our quality of life and can really make us very isolated, whether it's the larger circle of friends, but even in your close relationships with your husband, your wife, your children. It can become difficult because sometimes people will tell me it's easier just not to do it. But unfortunately, that's the worst thing that you can do, right? Again, if you don't use it, you lose it. So if you're not speaking to people, if you're not engaging in things, that will make the progression much worse. So our goal is to really get you involved and back involved in your own life if that's what's been lacking. So as Gloria stated earlier, we do have a Parkinson's program here. I work at Glen Cove Hospital and in inpatient rehab. We have a program here where people come in for acute therapy. So they're here for about 2 weeks and they get speech, physical, occupational, recreational therapy every day. Well, 5 days a week for the 2 weeks. And we've seen some really amazing changes in people. I will tell you about 2 of them. Oh, I'm sorry, I lied. I'm going to show you the video first. Sorry about that. This is the Speak Out program. This is from their site, actually, and it just shows a couple of people that have gone through the program. So I'm going to show you this. Hopefully the sound will work okay. Is the sound okay, Gloria?
It's perfect. It's perfect.
Thank you.
Has anyone said anything to you about your voice?
Well, sometimes my daughter will say, clear your throat, or my husband will say, clear your throat. I've noticed that I speak with clarity and I articulate better and I speak with intent.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. It's not low enough. You don't understand. My daughters have all been very pleased, and they've all said that I've got my old mum back.
I'm hoarse, and I don't have the energy to get the words out a lot of the time. I feel more confident when I speak. I'm not afraid to initiate the conversation, which before I probably would kind of say, oh, I don't need to speak unless I'm spoken to. I'm definitely more social. I don't even have to ask them. They tell me that they really can understand me better, and my voice is very clear, and they're amazed.
So as you guys can see, the reason I really favor the Speak Out program for us is because you really do see that big of a difference in a very short amount of time. I will tell you here. Oh, hold on one moment. Here we go. Okay. I'm just going to tell you quick about two people that went through the program here that I really feel like had a significant change. I feel like people do in general, but I'll tell you about Mr. DM, who was a 65-year-old male. He was in the program last year in 2019. He was diagnosed with Parkinson's in 2001. His past medical history is listed. He had a CVA with no residual deficits. He had cervical spine decompression, left shoulder fracture, sleep apnea, and depression. On admission, he had very poor vocal volume, slurred speech, complaints of choking with hard solids. He was a stage actor and had stopped acting because of the voice. He was a husband and father, and really even him, his wife, his daughter both reported that he was much more isolated. He didn't really want to see friends anymore. He wasn't interacting with even his grandchildren as much anymore. And he went through the 2-week program. We did Speak Out, and afterwards, well, even honestly, even into like the 3rd session of it, we started seeing a very significant difference. His daughter called me after a week and said, wow, my dad he has his dad voice back, which was good and bad because now he was yelling at her again. But it really was a pretty significant change for him. And by the end, he was talking about going back to acting and even maybe doing a documentary about Parkinson's and how it affects your life. He started contacting people from his acting world again. So it in a very short amount of time, it made a really significant difference for him because of the fact that he was able to kind of go back to his life a lot more. And that's really the goal. Okay, so that was DM. So JP is another patient of mine. He was 72-year-old male. He'd been diagnosed in 2014. So less time for him, but still complained of the slurred speech, reduced vocal volume. It was moderate with him, and pill dysphagia. So he had difficulty. He was starting to notice the difficulty with pills. He had been a bartender, something he loved to do, and had stopped because of the difficulties he was having, because people couldn't really hear him. So he went through the program here. We did the 2 weeks of the inpatient rehab. He participated in Speak Out, and we had a reception here for the first 25 people that went through the program. And he was asked to speak, and he got up to the podium, which had a microphone, and he asked for the microphone to be removed. asked me to go to the back of the room so he could prove it to me, and did his speech without using a microphone, and was absolutely beautifully heard by everyone. So people really do makes a significant difference. Whether it's the speak out that you do or LSVT loud, it's just important to know about what's out there, that these things are available to you. And I've included some resources here. The Parkinson's Voice Project, which is, as I told you, does the Speak Out program. The Lee Silverman Voice Training, which is the LSVT Loud, the website for them. The American Speech Hearing Association has some really great resources, some information. The Parkinson's Foundation Helpline. There are people there to answer, I think 24/7, and really can help with a lot of resources as well. And then I've included the places that I know that do the Speak Out program and that have specific Parkinson's programs, which is NYIT here at Glen Cove Hospital, STARS is our outpatient, and Queens College, the Speech and Hearing Center there, I know also has a Parkinson's program. And please feel free to, I've listed my email in the chat. If you have any questions, please feel free to reach out to me. I'd be more than happy to help. And if you have any questions, please feel free.
Guys want to put some questions in the chat? This is a good time to do it. Or we don't have that many people. If somebody just wants to unmute themselves and speak out, you can. But this is your chance to ask Trina some questions. Anybody?
I know that the program at NYIT was suspended for a while because of the fact that they lost the instructors that they had, and also because of COVID.
Mm-hmm.
Do you know, is it an in-person or a Zoom program that they have right now?
Hey, Paul, it's Sam. We're back. We're doing both. We're doing
Okay.
in-person evals,
so.
and we're doing some speech therapy via Zoom as well.
I see.
Okay, thank you.
Thanks, Trina, for the mention.
Of course.
Trina, I have a question actually.
Mm-hmm.
When you mentioned the inpatient, how do you end up in inpatient at Glen Cove to get the treatment?
So right now it was started by a specific doctor. He's a movement disorder specialist. He's actually came from Lenox Hill, and he really initiated this. So your neurologist would initiate this with Medicare.
Mm-hmm.
And you have to go through the evaluation. I really can't speak to exactly what they're looking for, but it's really for people that have had a significant decline of number of falls. But the doctor would make the referral, and then our people from here would discuss that with your neurologist.
Mm-hmm. Okay. Thank you.
Sure.
Anyone else? Some questions?
Yeah, I could ask another one.
Mm-hmm.
I was very involved in a yoga program and also in the NYIT boxing program.
Okay.
And then I sustained, my right knees developed arthritic pain to the point where it's hard to even walk, when having nothing to do with the Parkinson's, but it's limiting my physical activity a great deal.
Mm-hmm.
Are there any exercises I could be doing to help myself when I can't hardly walk?
That I could see that being a little bit difficult. Are you going for physical therapy at all?
I tried the physical therapy for my knee, and it actually made it worse. It seemed to exacerbate the pain, so that I stopped that, and I'm having a series of shots, but so far they haven't helped.
Okay. I do think that physical therapy would really be the best, or your own movement disorder specialist can really speak to that a little bit better than I can with the physical exercises, because I can see you've had and you have more going on. So I would think your doctor would probably be the best one, or the physical therapist might be able to help you a little bit better with that. Sorry.
Yeah, thank you.
Of course.
Anyone else? Questions?
As I said, I've left my email address in the chat. If anyone thinks of any questions later on, please feel free to reach out to me, or Gloria can reach out to me as well.
You want Queens College too?
I'm sorry?
I can also send out this resource page. I will send out the resource page, but it'll also go onto our website. So if people have more, want to reread it, re-listen to it, and get the resources, it will be recorded and be put onto our website.
Gloria, it's David. I missed the presentation. I was just wondering whether it's on tapes where I can get a copy of it sent to me.
It will be recorded. It'll be on our website.
Beautiful. Thank you.
Yeah, Ava has a question. Go ahead, Ava.
Yeah, it's really not a question. I wanted to say it before we started. My granddaughter works in the hospital where you are, and she is in the ICU as a telemetry technician.
Oh, wonderful.
That's Shira's daughter, Gloria.
Oh, okay. Lovely, lovely.
That's so nice. It's a great place to work.
Yeah.
Oh, Glen Cove Hospital, sure.
Mm-hmm.
Terrific.
Yeah, I've been here a little while. I like it here.
My daughter used to work there as a social worker. They had a program there for to help addicted women with children.
Wow.
Oh, okay.
Wow.
Yeah, she was there for
That's
about
wonderful.
5 years. Until she started popping out babies, and then she had to take a break.
Okay. Okay.
So Trina, I apologize if I missed this. I was in the midst of some telehealth as well today. Do you have any groups that you're doing? Or do you have do you do like a speech group via Zoom, or singing groups, or
the outpatient part is a little bit different. It's a little bit separate.
okay.
And
So you're strictly inpatient then?
I do only inpatient, but Susan is our outpatient therapist here. And I believe the Loud Crowd, she is starting to resume, but I think it is being done virtually. So after you go through the Speak Out program, as you know, it's, I think, 12 weeks as outpatient. You then can go to the Loud Crowd, which is once a week. And I'm pretty sure Susan has resumed.
I was asking a question.
Okay, if you happen to find anything, if you could just share that with Gloria. I know the Speak Out, I mean, we've always been LSVT. One of our therapists was with us dating back to 2006. And the Voice Project's great because they give you this nice book to use and a lot of information. But I know people have been engaging out east. There's been some Loud Crowds, and I was looking for something local. So if you happen to,
I'll verify with Susan. We're also working on wanting to start a support group as well.
Okay.
Sure. Things are just so difficult right now, but we are working on it, and I will let you know for sure about the Loud Crowd.
Yeah, get us some information so we can put it out there. Absolutely.
Okay. Absolutely.
Yeah. Great.
Thank you. Appreciate it.
Oh, somebody's got a lot of feedback back there.
That might be Martin, looks like. Martin, did you have a question?
I do, Sim. Do you have speech therapy at NYIT?
We do. Yep. As I said, we're doing some most of our evals we're doing in person, and then we're trying to transition over to some Zoom. But most places that are Stars as well, I think, is doing a lot of virtual as well. Correct, Trina? Yeah.
For us, we're doing in person here.
Oh, you are? Okay.
Yes. For the individual.
Yes. Yeah.
The one I wasn't sure about is the Loud Crowd, which I will find out. But in person, we are doing the sessions here.
Trina, can I ask you a question? Are family members involved in any of this in terms of being able to support whatever the patient is doing and be able to continue it at home?
Yes. So I always send the patients home with an exercise program. All three therapies do. physical therapy, occupational therapy. We try to involve family as much as possible because we're aware that it doesn't just affect the individual, it affects everyone. So we want them involved in therapy. They often will come to therapy, and we do training before people go home before discharge. So we can really educate a little bit and discuss, and also talk about some strategies that people can have when they go home to improve their communication. I think it's incredibly important for the family to be involved, for the care partners to be involved, and also be able to discuss what their difficulties are. You know, I've had people come in and say, well, in our house, this is what happens. So it's great to know things like that so you can address it more personally.
Yeah, absolutely. Thank you.
Of course.
Anyone else? Questions?
I have a question, may or may not be related. So we have Dr. Leader who works with us. She's our movement disorder specialist, and she frequently refers for a modified barium swallow. Does Glen Cove do those, or only the main campus, Manhasset or LIJ?
LIJ has been doing the outpatient ones. We haven't resumed doing outpatient ones as yet. So we're primarily going to LIJ right now.
Could you tell me what that, can you tell me what that is, since I don't even know what the
Absolutely. So it's called the modified barium swallow studies. So you come in, it's essentially an X-ray of the swallowing mechanism, but it's a video. So we put barium, this white powder, in regular food. So we do thin liquids, and we go through all of the different consistencies to see what's safe. And we watch the swallow, essentially. It's an X-ray. So we can see exactly where it's going, in case there is aspiration, exactly where the breakdown is, the muscle function. And then we can decide what's the safest diet and the least restrictive diet. And then it also guides us to know, do we need some of those compensatory strategies or techniques? Do we need to modify the diet? And what exercises should we really target to get the function better? There's 2 objective tests that are done. It's the modified, the other one is called a FEES. It's a fiber optic endoscopic evaluation of swallow. And that is a scope is placed through the nose down into the throat, and we watch through the camera as we feed things that have dye in them. So those are the 2 tests that are typically done to assess swallow function.
And you're saying you don't do those, or you do those? I'm confused.
We don't as of yet. We have in the past. We had stopped because of COVID. So when we haven't resumed yet, but I know LIJ does outpatient.
Yeah, that's where I had gotten mine done at LIJ. The taste of it is absolutely horrible.
Sorry.
It is what it is.
Well, we try to mix it with regular food to hopefully take away from that a little bit. It doesn't work, does it?
No. But it definitely helped.
Yeah.
As far as the seeing what was actually going on with my swallowing. And then I had exercises I did. I got the the thicker drinks. And they're available on Amazon. So
they're easy to purchase. I hope you're still doing those exercises.
No. I've got other stuff, but I'm gonna go back to
good
person, because as you can hear, I'm having problems speaking.
But you know that there's things that we can do about that. That's the important thing, right?
Yeah.
And we appreciate the honesty.
Not a problem.
So the
Okay.
modified Gloria, it's a great test because it's not just an X-ray. The speech pathologist provides a very detailed report, which often guides treatment. So,
Mhm.
and as I said, Glen Cove was a frequent place we forwarded. You know, it's a
Yeah.
great little hospital. So
Yeah, we're hoping to start again.
Good
Good,
for us
good,
to
I'm
know.
glad. Thanks for sharing that.
Because I was unaware of that. You know, sometimes we think of Glen Cove being so far away when we talk about the South Shore for us particularly.
Sure.
But the reality is you have such a specialized program that it's important, and people are willing to go pretty much anywhere to get the right
Yeah.
kind of service. So
Mhm.
so it is really good for all of us to know what the programs are that are available and where you're going to get the best and most specialized care. So we're very grateful for that.
And we've actually had some patients that were hospitalized on the South Shore, and as part of discharge, then were transferred to Glen Cove for continuation of therapy and had very, very successful outcomes.
That's interesting. Okay.
Yeah. Yeah, we have a pretty significant acute rehab here.
Yeah. Yeah.
It's wonderful.
Well, good. Okay. All right. I think we're just about at that time. Yes. So I want to thank you so much, Trina, for your really, really informative presentation. We will make sure to get this on our website so more people can benefit from your from the information and can get a hold of the resources. Just remember, everyone, Trina's information is in the chat. You can check the chat. Her email is there. My email is there. So if you need anything, that's one way to go. But
Absolutely.
you also can get in touch with Sim or me, and we will certainly pass all this information on to you. So thank you again, and thanks everyone, and have a wonderful, wonderful afternoon, everybody.
Thank you so much for
Thank
having me. I
you.
appreciate it.
Thanks,
Have a
Gloria.
wonderful day, everyone. Bye-bye.
Bye, everybody.
Bye, everybody.